Hi, it's Dr. Z. This week we'll be learning about schizophrenia and other psychotic disorders. This chapter is separated into 4 sections: schizophrenia and other psychotic disorders, and the last 2 sections on etiology and treatment. Let's get started with this week's overview. By the end of this week, you'll be able to complete these district course competencies and learning objectives. For this week, please watch the module review video here. The first section is on schizophrenia. In Greek, schizophrenia means a split from reality, not a split from the mind, but a split from reality where the individual experiences serious impairments to basic psychological functions. These impairments may result in hallucinations, delusions, and/or disorganized behavior. It will be important to differentiate between the positive and negative symptoms of schizophrenia for diagnosis. Please read the designated pages in the textbook and complete the corresponding Nearpod lesson. The second section is other psychotic disorders. Schizophrenia is the most common type of psychotic disorder. However, just because an individual has a psychotic episode or experiences psychosis does not mean they automatically have schizophrenia. The textbook introduces several other psychotic disorders. Please read the designated pages in the textbook and complete the corresponding Nearpod lesson. Every week, the activity will give you the responsibility of being a psychologist for the day. Because diagnosis is so important to our role as psychologists, this week's activity involves applying your knowledge of schizophrenia and other psychotic disorders to a case history. For this activity, you'll be given the case histories of 5 different clients, and your job will be to diagnose the client assigned to you. This activity will prepare you for discussion board number 5. Additionally, there will be 2 questions in application paper number 4 regarding your client. The third section is etiology of schizophrenia. This section reviews the genetic, biological, psychological, and/or environmental causes of schizophrenia and other psychotic disorders. Please read the designated pages in the textbook and watch the assigned videos here. The fourth section is treatment of schizophrenia. The primary treatment of schizophrenia and other psychotic disorders involves biological treatments, though there are several psychosocial treatments that can be effective. I want to point out this TED Talk by Eleanor Logden about her experience with schizophrenia. It will prepare you for application paper number 4. Please read the designated pages in the textbook and watch the assigned videos. So let's go to the assignments for this week. The first assignment is the Nearpod lesson. This Nearpod covers the first part of the chapter on schizophrenia. Please note the important heading. Nearpod lessons are due on Wednesdays at 11:59 and need to be completed before the weekly discussion board. The second assignment is the discussion board on diagnosing schizophrenia and other psychotic disorders. This discussion board ties back to the activity of diagnosing your assigned client. For your discussion board, you will share your diagnosis for your assigned case history. Please include criteria for symptoms that are important for diagnosis, define your psychological disorder for the class, and name the disorder. Additionally, I want you to engage in differential diagnosis with your assigned client. Please explain if any symptoms may also look like another psychological disorder. The third assignment is the chapter quiz. I encourage you to spend time differentiating between schizophrenia and 2 other very similar psychotic disorders: schizophreniform disorder and schizoaffective disorder. And finally, the last assignment of the week is the application paper. Question 1 reviews a section on treatment of schizophrenia, and ask for a reflection on the TED Talk. Question 2 and question 3 ask you to expand on the activity diagnosing schizophrenia and other psychotic disorders. Question 2 asks you to pick a specific etiology or cause discussed in the textbook and apply it to your assigned client based on your diagnosis. Question 3 asks you to pick a specific treatment discussed in the textbook and apply it to your assigned client based on your diagnosis. And as always, your fourth question is your wow moment this week. And with that, my friends, you will have successfully completed this week's module. I look forward to reviewing your awesome assignments this week.